Okay, this video is called What We Should Be Studying. I thought I was done for videos for the day, but I just got this thought, so I crank out a video real fast. I write it all down. Basically, most modern research is some version of how can we sell more drugs or more lab tests or more imaging tests, procedures or surgeries. The goal is almost always how can we make money? And even if they theoretically are doing original research, basic science, they always have to say when this might offer new options for drugs here, new options for drugs there. And that's why almost all of that research stinks. If you really know science, the reality check is that Walter Kempner had much better results treating patients in the 1940s and 50s than we have now. So why is it that, the guy had better results 75 years ago, more than 75 years ago than we do now? It's because our modern system is fundamentally dishonest, and that's because it's based on atheism. To me, this is so obvious. I feel like almost like, why am I repeating this? But under atheistic systems, what matters is self-interest. Might is right. Survival of the fittest, okay? And the sad fact is that, the patients have no money. They have no power. There's nothing that a patient could do to improve things for a hospital or for a doctor, okay? So no one cares about them. Everybody in a meeting is always going to say, yes, it's about the patient, it's about the patient. But in reality, they hide behind the standard of care, which is fake, and recommends to sell drugs and surgery because that's what keeps you out of trouble. That's what pays the bill. That's what meets the requirements of the insurance company billing code fee. Okay, so what should be studying? We should be studying how do you improve physical performance? How do you improve cognitive performance? We should be doing randomized control studies of drugs versus surgery or pills for all kinds of things, for obesity, for hypertension, for diabetes, coronary artery disease, gastroesophageal reflux disease, autoimmune disease, but it never could be done. The regular public is hopelessly stupid and gullible. They think that anybody cares about them. Nobody cares about you. The only people who care about you is if you're lucky, your spouse, your children, your parents, okay, a couple of your close friends. And that's important to realize because if you realize that nobody cares about you, you're less likely to be a chump. And so you got to study whatever you're interested in for health because that's your best chance to have a good outcome. Doctors can help you in their areas of expertise, and it's good to talk to them sometimes for that. But if you think that the system is going to serve you out of the kindness of its heart, you're sadly mistaken. We could be testing, different types of pre-workout meal, different types of hydration, different types of electrolyte solutions, amount of sugars, amount of salt, amount of sodium, amount of potassium, and all kinds of solutions. What generates the best athletic performance, the best cognitive performance? What generates the longest life? All these twin studies are a good idea. What's the best K factor for optimal performance, for optimal longevity? What percentage of starch versus fruits or veggies for optimal athletic performance or cognitive performance? For younger athletes, what percentage of animal protein, if any, should be given to them to allow increased physical strength, okay? How little protein or fat or sodium can we feed people under controlled conditions and maintain high levels of health? Randomize patients with the common fractures, see what type of diet and lifestyle routine heals them fastest. What diet's best for all children? What diet is best to minimize symptoms of ADHD? What diet best to optimize body weight? Kids, young adults, middle-aged adults, older adults. We kind of already know the answer to that. Low-fat, low-sodium, vegan, starch-based. But, the fruits are better than is widely given credit for. But there are some issues with fruits. Anyways, that's where it would be nice to see things go. It'd be nice if there was like a benefactor that wanted to see this happen at one of these colleges going out of business. But, good luck finding that. Anyways, just a couple thoughts on what we should be studying.